Coming up, we'll be on location in Falls Church, Virginia at DC VA Counseling Psychotherapy, LLC, discussing the latest advances in mental health counseling and how they can help you effectively improve your mental health and wellness and help you achieve the goals you've always desired with 5 of this area's top psychotherapists, including the director of the center, Isabel Kirk. Welcome, Isabel. It's a pleasure having you on our program today.
Thank you so much. So happy to be here.
I wanted to ask you, Isabel, what drew you into this field? Why did you choose to take that step into the mental health counseling field?
I became a therapist because psychology has always been my passion. I developed an interest in that since I was a little girl. And then through life, I've found myself always questioning life, even with friends and with colleagues. It's always one of those people that you can just not stop thinking. And therefore I decided to make my hobby my passion. Went to school. Throughout life I had many transitions. I grew up in one place, I moved to the United States. I was very different from the environment that I grew up. The same with my family. And mostly what I want to communicate is that, again, therapy could be for people that have very loving families, that have a normal upbringing. We are humans, we are not perfect, so there are always things that could be a little bit better or that need a little bit more of vitamins, I call it. And therapy is all about that. It's also for people with big traumas, as we know, people that have been at the war or had, unfortunately, very difficult circumstances such as childhood abuse or living in very traumatic situations, but it's also for people that have very normal situations and still can suffer from symptoms like I did. And it's been through my personal journey that I became passionate about this and will continue. I don't plan to retire.
Anytime soon, right?
Anytime soon,
You're
exactly.
helping too many people. Now you are the director here of this wonderful center that you recently opened in the region.
Correct.
And we're going to be hearing from not only you, but 4 of your colleagues here following this interview with you. But I wanted to begin by having you on first to tell us, first of all, about the center that you opened.
Sure, I'm very excited about that. Well, psychology has always been my passion. And during my journey as a psychotherapist, I've been doing this for almost 14 years. I've noticed how the field has been changing, and psychology started a lot with trying to treat pathologies and getting people healthier, which it's part of what we do. But also, I've been always really interested in the field of positive psychology, which got me into the field of attachment theory. And what it does is there are, thank God, more research right now to really find out what actually works in people that are healthy and that are happy.
Yeah.
So that's a little bit my vision for the center, was to get together with other mind-wise therapists that try to work a little bit in treating the conditions and helping people to be happier and healthy from the longer term. Not only treating the symptoms, but also helping them from the inside out to become healthier and live more fulfilling lives.
So you really, not only you, but your associates and colleagues here, your team, basically looks at each of your patients in a holistic manner, as far as looking at that person as a whole, not just looking to help them with the problem or issue they may currently have, but how you can help them with a long-term, lifelong solution.
Correct. Because one of the things that happens many times, if people only are treated by the symptoms, the condition remains in there, and then life hits hard sometimes.
That's right.
And then we're back at the beginning. But at DC VA, we try to actually help the person to get new skills and heal some of the possible conditions that had been interfering with their present and future lives.
I wanted to ask you, for the folks out there watching, when they first contact you, can you please tell us about the process they would go through? And I'm sure that would involve initially an evaluation process, right, at the initial consult.
Correct. And what I'm trying to do is to keep the center really personal. So in my experience, to reach out to get some mental help it takes a lot for people to be able to do it. So I try to answer the phone calls and emails myself personally, and then get an idea of what type of situation they're dealing with, what type of help they need. And then if it's not me, I try to refer them to the person that would be a better match for them. And following that, they proceed to schedule an intake assessment, where the therapist and the client can figure out if they're a good match, what type of goals they're gonna set, what the treatment would look like, and go from there.
And so you then would customize a plan between yourself and your colleagues, who each have their own specialties here at the center with their own expertise, all working together as one team with you as the director here. So you then customize the appropriate plan based on what each of your patients' goals are and what their conditions are, right?
Correct. And we tend to have a collaborative approach, meaning we are the professionals, but also we try to really listen to what the clients need and what they want to work on.
Yes.
We can also provide, obviously, suggestions to what we think, but even that is customized. Some people want a little bit more guidance. One of the things that I feel my passion is to also communicate out in the world that therapy has changed a lot. Is not what we tend to see anymore with one person sitting and talking by themselves. It's very relational. And that's part of, again, my vision is to continue to spread the word out about what therapists are doing now. And part of that is to have a collaborative and egalitarian relationship with the clients.
Absolutely, and that's what psychotherapy is. It's talk therapy. So you really talk and have, like you said, a one-on-one an appointment each time with your clients.
Correct.
And folks, and really help them achieve their goals. And I love the fact it's a boutique practice, right?
Correct.
So it's very personalized here.
Yes.
And the experience is not one where they go from, every time they come they see someone different. That's not the case at all. They would see the same therapist, right? That they initially met with, so they feel comfortable and build that trust between the two of you to really help each of your folks.
So part of the customization that we do is depends the level and the help that the client needs. Some people have been in therapy before, and there is situations where talk therapy is not enough. Fortunately now, thanks to the neurobiology studies and the findings in neuroplasticity, the brain can change every day. And what we do a part of talk therapy is also we include process-oriented orientations that help heal the trauma in a deeper level. We bring the emotion with the client, the memories and the sensations during the session, and we help them process. The body and the mind have a natural curve of healing, but it's in relationship that happens. So it's through the relationship and the professionalism that the therapist brings that healing occurs. And only after that healing, the people can start having different behaviors and different interactions in a more long-term basis. It's not just something that they learn. Even people, when they say they're coming because they have a lot of communications problems, the bottom line of the communication is the wounding and the unresolved trauma that they might have. So we work with that individually and in relationship to heal that, and therefore the new skills could be learned in a more natural way.
Yes, indeed. Very interesting, Isabel. And I wanted to also ask you, what types of conditions do you and your colleagues help folks with? For folks out there watching to see if, one of those conditions that they may have is something you all can help them with.
Correct, yeah. Well, anxiety and depressions are the basic ones, it's part of life at this point. So we help anybody that might have those symptoms. We recommend also to not wait until people are really suffering from it. The sooner people can come, the better. And we hear that from clients all the time. They wish they would have come earlier. So that's the majority of people. We also do a lot of relationships, couples. It could be marriages and any other types of relationships that people might be dealing with. We also see people with eating disorders or disordered eating, which is one of the conditions also that we treat. Apparently there is like 1 in 5 people right now that suffer from some sort of disordered eating. Not only the people that are diagnosed with bulimia or anorexia, but also body image, excessive exercise or preoccupation with food, eating healthy, So, which is also again a manifestation or a symptom of something a little deeper.
Yeah.
So we work also with experts on that and collaborate with nutritionists or psychiatrists around the area.
So you really are a comprehensive center as far as helping a wide range of folks out there with different varying conditions.
Correct. Another one that people specialize here is in terms of grief. Not only grief in terms of death or losing with losses, but also transitions in life,
Yes.
Big losses that people might have sometimes in terms of health,
Yes.
or people in their lives, or capacities in their life. You know, sometimes they have health situations that changes completely the way they have to live. So that's another one of the specialty here is grief and loss. As I'm saying, not only life and death related, but also throughout life.
And addictions, I would think, are another problem that you can help people with?
Correct. Addictions and compulsive behaviors. We, as I mentioned, we do have an intake assessment, so depending on the level, we might need to collaborate with other more inpatient or severe treatments.
Sure.
But we do again do the longer term treatment of the trauma that is actually feeding the substance abuse or the compulsive behaviors that they might have, depending on, again, the level of severity that they come with. Most of the people that we see at the center are pretty functional, so they are trying in a way to work on their issues while they're also performing in life, and we try to maintain that as much as possible, while also helping them to deal with the underlying again, trauma or unresolved issues that they might not be able to go by themselves, so they can actually overcome the addiction or the behavior that they're dealing with.
Yes, indeed. And before we let you go, Isabel, because we're going to be hearing from your
Sure.
colleagues here as well, is there anything else you'd like to add for our viewers?
Yes, I think my biggest desire is to communicate that therapy, it's a wonderful experience. It's healing. We do it with people. We are not supposed to do it alone in the world. And most people that come, as I'm saying, wish they had come earlier. Even if it's not because you are completely suffering from a mental disorder, we need skills. We live in a more isolated world every time. So coming and relating and trying to figure out who we are so we can not only be out of disease, but also have more fulfilling lives. And that's one of the passion at the center, is to help people thrive.
Yes, indeed. Well, you all are helping so many folks, and you are changing lives and helping people get back to who they were or where they want to be. So on that note, I'd like to thank you, Isabel, for joining us and being a guest on our program. It was a pleasure having you all.
Thank you so much.
Our number 2 guest today, following Isabel Kirk, is Caroline Connelly. Welcome, Caroline. It's wonderful having you on our program today as well.
It's nice to be here.
Now, I understand you're also a psychotherapist here at the center.
Yes.
And I wanted to have you please tell us a little bit about yourself, your background, and your approach.
Well, thank you again for having me here. I first started my career working in psychiatric hospitals as part of an extensive treatment team. I then chose to work outpatient starting in 2012. I work with older adolescents, young adults, adults, and couples.
Oh, interesting. And so you've got several years of experience working in those with those types of conditions, right? As far as
Correct,
helping younger kids, children, as well as adults on the couple side.
Correct.
With
yes.
your background. And as far as your approach goes, can you tell us a little bit about that?
Well, what I usually tell my clients is we are on the journey together.
Yes.
I am not an authority instructing them what to do. So what I try to do is get them to tell me where they want to be in life. What are certain things that are not satisfying? And what are some goals to improve their general quality of life?
Interesting.
Generally, people come to see me that have been depressed, anxious, or going through life stressors that are hard to manage.
Yes. Yes, and then they come here, you put them through an initial evaluation, right, in the consult, and then customize a plan that can help that particular person or persons if it's couples counseling.
Yes. Now, when I work with couples, they have a fracture. They were connected at one point,
Yes.
and over years, they've slowly grown apart. I often hear from couples they feel like they're roommates. They're not emotionally connected. There's usually some resentment that has been built up, unfair fighting, keeping score, calling names, etc. And what I try to facilitate is for them to get to know one another again. It's intense work for both people, but it is very rewarding. I find that if you engage in couples counseling, then you are less likely to do things that are beyond repair.
Yes. And again, I'm sure this depends on each of your clients and their particular situations, but in general, do you like to have them come in at least once a week, twice a week initially, or even more than that depending on their situation?
With my clients, I recommend weekly
Okay.
to begin with. Now, sometimes people have very hectic schedules. A lot of my clients have to travel for work, so it is not ideal, but sometimes we don't meet more than twice a month.
Okay.
Some people are very frustrated once they come to therapy. And it's a challenge to explain to them that things are not going to be fixed right away and that it's a process.
Yes, it is not like a magic wand and boom, you go to a mental health professional and you leave all back to where you want it to be, right? Doesn't work that way. It is a process like with anything. And they have to, I would imagine, be willing to, it's like a partnership, work directly with you, the practitioner, to really help them get to where they're striving to get to.
And it's hard work
Yes.
that they do. It's very emotionally fatiguing at times.
Yes, I can imagine. Yes, indeed. And before we let you go, is there anything else, Caroline, that you'd like to add or say for our viewers?
Well, I find that a lot of people have attachment issues, particularly in couples counseling. There is a lack of confidence of being supported. Some people feel that they've wasted years of their life in professions that they don't like, family of origin conflict, individuals I see that also have relationship issues. I often see people who have challenges parenting, which is very difficult in this day and age.
Yes.
But I also find that most people want to achieve fulfillment and change over time.
Yes, indeed. And you're doing some wonderful work, you, your colleagues, all of you here at the center. And on that note, we'd like to thank you as well, Caroline, for joining us and being a guest on our program. It was a pleasure having you on as well.
It was my pleasure as well. Thank you so much.
Thank you. Welcome, Lisa. Nice having you on with us as well.
Thank you.
You are also a colleague of Isabel and Caroline, who we just heard from a few moments ago here at the center. And
Yep.
I wanted to ask you if you could please also tell us a little bit about yourself and your background.
Sure. I'm a clinical social worker by practice. I call myself a psychiatric social worker, and I work with adults and I work with couples. I've been in practice over 20 years. I have a lot of special training and a certificate in couples therapy. That's really my passion, is helping couples improve their communication and have the most fulfilling and satisfying marriages they can.
Yes, indeed. Trying to help them get back to where they were when they first fell in love, right?
Exactly.
And-
We all wish we were back there.
Yes, indeed. Now, again, I'm sure it depends on each of your clients and their specific situations, etc. But in general, how often do you initially like to see them? Once a week, twice a week?
So it all depends on the situation. If people are in crisis, sometimes they will come in twice a week, but
Okay.
typically it's once a week. My first session, at no extra cost to the client, is always an hour and a half.
Oh,
Because I find that meeting with people the first time, there's so much information to be gathered.
the initial consult, basically.
Correct,
Yes.
correct.
That is very important to really get to know them and what they're looking to achieve and what they're currently going through.
Exactly. And then You know, with couples, I'll often continue to meet for an hour and a half. It's sort of as they need. Do they need to meet for an hour? Do they need to meet for an hour and a half? With individuals, I work a lot with individuals who are struggling with anxiety or depression. It's typically once a week for an hour, sometimes twice a week.
And what would you say is your approach with each of your clients?
I use a really eclectic psychodynamic approach.
Okay.
There's a lot of CBT, cognitive behavioral therapy, but it's really we let the client decide where they want to begin.
Yeah.
The social work theory is very much start where the client is. And whatever issues are going on with them, a social worker looks at the person in their environment, and we look at their entire lives, how their relationships are, how their work is, how they're, do they have personal passions, things they are really excited about, and those are all parts of a normal, healthy adult life.
Yes, indeed. And before we let you go, I wanted to ask you as well, Lisa, if there's anything else you'd like to say for our folks watching.
I feel like therapy is a luxury that anybody could benefit from, and to have an hour or an hour and a half where you get to talk about yourself or what you are struggling with in a really objective, safe place is an amazing opportunity.
Yes.
Who wouldn't want
indeed.
that?
Absolutely, because we all have different things that may be bothering us or we may be dealing with, and what better way to really start releasing all that and really hopefully getting it out of our system, right?
Exactly.
Than to meet one-on-one with someone like yourself and your colleagues here.
Exactly, and I've struggled with my own issues, and I know how much suffering people go through is really unnecessary.
Yes.
And how easily it can be overcome with some helpful tools.
Yes,
and so
indeed.
I really enjoy working with people and help them overcome their struggles.
Well, on that note, we'd like to thank you,
Thank
Lisa.
you, Rocco.
It was a pleasure having you on as well also.
Thank you.
Welcome, Valaria. It is great having you on today with us.
Thank you very much for having me.
Now, you also are a colleague of Isabel and the other wonderful folks that we've heard from today here at the center, and I wanted to begin, like I did with each of them, by having you please tell us a little bit about yourself and your background.
Okay, I moved from Italy not long ago, and then I came in this country in the United States. Before I was in New York, where I obtained my master's degree at NYU as a counselor in mental health and wellness, and now I'm here in Virginia.
I wanted to ask you, who is a good candidate as far as that you're able to help based on the conditions that he or she may have?
Okay. I love working with the couples, and my theory framework is emotional focused couple therapy, EFT, but I also enjoy working with the individual, with the anxiety, depression, so especially people that are moving in this country from other part of the world, and they're struggling, adjusting with their life here in the United States.
Yes, and you have first-hand experience with that, having come from Italy, as you said a few years back,
It's true.
to America. Now, as far as, I'm sure this depends again on each of your clients and their particular situation and condition, but in general, how often do you recommend seeing them initially?
I would say definitely people have to see therapy as a good way to...
Like once a week, twice a week?
Yes,
Yeah.
usually I see client once a week,
Okay.
but I do have, sometimes it depends on the situation, I do see clients maybe twice a week.
Okay. Certainly depends on each client, as you said.
Yes.
And before we let you go as well, I wanted to ask you, Valaria, if there's anything else you'd like to say.
I would like to say that therapy has something, it's wonderful, and then everybody should necessarily looking for help, and just to have somebody to talk to with some issues, it's very helpful in any stage of a life of an individual.
Well, you and your colleagues and Isabel, who we all heard from today here at DC VA Counseling Psychotherapy in Falls Church, Virginia, are doing wonderful work for the community. You're helping so many folks, all of you together, and it was a pleasure having you on as well. And I wanted to thank you on that note for being a guest on our program. I appreciate it, Valaria.
Thank you very much for having me.
Thank you. You also hear, excuse me,